Hi everybody, welcome to the Health How-To channel where we talk about some great life hacks and easy tips to achieve better health. In this video, we're talking about how to fix knee pain, where I'm giving you 33 do's and don'ts to stop knee pain. Please subscribe and share your best tips that you have found to be super helpful for fixing your knee pain in the comments section below. If you have someone in your life who you want to help, please share this video with them too. Also, this video is purely for informational purposes and does not in any way replace any advice given by your own healthcare providers. If the exercises or information suggested aggravate your condition, please stop and ask your healthcare provider for further direction. Let's start with a little knee anatomy. To keep things simple, we can think of two main components of the knee joint. The first is the knee joint itself, which acts like a door hinge, and it has two main movements, bending and straightening. It needs to be really stable to function at its best. The second component is our kneecap, which we can think of like a train going down a track. Like a train, the kneecap itself has a lot of mobility, but it needs to stay firmly on its track. Otherwise, if it's constantly being forced on one side of the track, a lot of grinding and friction happens, which triggers inflammation, cartilage breakdown, and of course, pain. What can throw our knees off track? Sometimes there are quirks about our anatomy that we can't control, like being bow-legged, knock-kneed, or double-jointed. But a lot of the time, we can help influence other factors like the joints above and below, namely the hip and the ankle. One of the most common reasons for long-term or chronic knee pain is that the hip muscles are too weak or the feet are too flat or too highly arched. Both issues can make your knees turn inwards, causing the hinge joint to twist and throw the train off the middle of the track. Here are 33 do's and don'ts to stop knee pain. Number 1. Do see a health professional like a physiotherapist if you have knee pain for more than 2 weeks. They can evaluate your unique situation and make sure you are doing things that are appropriate for you. Number 2. Do use crutches or a cane rather than limping to avoid causing other painful injuries from compensation. Hold the crutch or cane on the good side so that you always have a large triangular base of support when walking. Number 3. Do control the swelling with ice, compression with a tensor wrap, and elevating the leg on a pillow for 20 minutes. Try doing this after activity or at the end of the day when the knee is swollen. Number 4. Do use a microwavable heating pad for 20 minutes to relax tight muscles and ease stiff knees. Try doing this after sitting for too long when the knee feels achy or before exercise. Number 5. Do heel slides where you slide your heel along the bed or floor and bend the knee as far as you can. Hold for 3 to 10 seconds and repeat 10 times. Number 6. Do quad sets. Tighten up the quadriceps muscle by pushing the knee down towards the bed. Hold for 3 to 10 seconds and repeat 10 times. Number 7. Do move your kneecap up and down and side to side to improve the tracking. Number 8. Do stretch your quadriceps. Lie on your side and pull your foot behind you. Hold for 10 to 30 seconds and repeat 3 times. Number 9. Do stretch your hamstrings. Lie on your back and use a strap to pull your leg towards you. Hold for 10 to 30 seconds and repeat 3 times. Number 10. Do stretch your IT band. Lie on your back and bring your leg across your body. Try not to let your back twist over. Hold for 3 to 10 seconds and repeat 10 times. Number 11. Do straight leg raises. Lie on your back and lift your straight leg up 3 inches. Hold for 3 to 10 seconds and repeat 10 times. Number 12. Bend your knees back and forth when sitting. Try not to tuck your feet under you for long periods of time. Stretch your hips and knees often when going for long drives. Number 13. Do strengthen your glutes. The muscles in your buttocks are the largest in your body. They are supposed to be the strongest muscles too. If they're weak, not only will you have a flat butt, but you can get back pain because they're not holding your back straight, and they can make your knees turn inward, which throws your knee alignment out of whack. Some beginner exercises can include side-lying leg raises and moving up in difficulty to sideways crab walk or stepping up forwards and stepping up sideways. Number 14, do progressively increase your exercises to continually build your quadriceps muscle, strength, and endurance. A good fitting stationary bike can be a really great way of strengthening your quadriceps and keeping the knee lubricated but without overloading your joint. Number 15, do consider using a brace to help give some support and compress the area to squeeze up the swelling. Wear it when you are exercising, walking outside, grocery shopping, or working in a more physical job. Number 16, don't cross your legs for more than a few minutes at a time. Also make sure to alternate which leg you cross over so that you don't develop muscle imbalances. Number 17, do put a pillow between your knees when sleeping on your side or under your knees when sleeping on your back. Number 18, don't stand with your knees locked or hyperextended. Keep a slight soft bend in the knees and have your hips stacked over your knees and ankles. Number 19, don't jut your hip out. Avoid standing with one hand on your hip, one leg out, holding a baby or laundry basket always on the same hip. Number 20, do wear good supportive shoes with a rubber sole if you're on your feet a lot. If you have flat feet, consider orthotics or custom inserts, which will give you a customized higher arch and stop your knees from turning inward. Number 21, don't wear high heels if you know you'll be walking a lot because it puts a lot of pressure on the front of your knees. Number 22, don't sit on your knees with your feet splayed out and teach your children not to W sit as well. Number 23, don't kneel for more than 20 to 30 minutes at a time. Use knee pads if working on the floor, or sit on an upside down pot when gardening. Number 24, do make sure your feet point forwards when walking and standing. Number 25, do run on the balls of your feet. Your heels will thank you too. Number 26, do take shorter stride lengths when walking so that you aren't jamming the front of your knees. Number 27, do aim for a 10-pound weight loss if you are overweight. According to a study, even a small 10-pound weight loss was able to slow down the progression of arthritis by 50%. When it comes to reducing constant stress on the hips, knees, and feet, every pound counts. Number 28, don't do jumping exercises or exercises that involve twisting or quick changes in direction when your knees hurt. Some examples of sports that are notorious for knee injuries are football, soccer, basketball, gymnastics, and running. Number 29, do have a coach look at your exercise technique. For example, don't let your knees turn inwards when squatting or lunge with your knees over your toes. Number 30, do have a professional look at your equipment. For example, your bicycle seat may be too low and causing excessive compression behind the knee. Number 31, do hold onto the handrail when you're on stairs in case your knee gives out. Number 32, do consider eating an anti-inflammatory diet to relieve pain and inflammation. Do eat omega-3 rich foods like salmon, mackerel, tuna, walnuts, and olive oil. Green leafy vegetables like kale and spinach, and don't eat foods with added sugar and highly processed foods. Number 33, do talk to your doctor to see if your knee is suitable for injectable options like cortisone to decrease the inflammation or hyaluronic acid to lubricate the knee joint. If you have some great health tips that helped you fix your knee pain, I'd really appreciate it if you could share them down below in the comment section so that we can all benefit in our personal journey to better health. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.